Hi, welcome back to Tuesdays with Kindness. I'm Dr. Stephanie Christian. This month I'm talking about the various procedures that can be done with the Precision TX. Last week I talked about the 10 in 10, meaning that people look 10 pounds lighter after 10 minutes of laser time, and it's specifically done for people who have a submental fat pad or a turkey waddle. But the Precision TX was originally designed for a neck lift. Now, this is not the surgical neck lift, and patients who really need a surgical neck lift should have a surgical neck lift. This is more for people who have mild to moderate double chins and mild to moderate sagging of the neck or jowls. What is the Precision TX? It's a combination of two technologies. One is the side laser. Most lasers, as I said last week, fire forward. This laser fires sideways. It's a very, very small laser. It's smaller in diameter than a spaghetti noodle. And so it can fit through a cannula and it goes easily under the skin. And it's combined with the thermoguide, which allows temperature measurement right at the tip of the laser. So it's unprecedented safety because you measure the heat exactly where the heat is being delivered. Most other technologies measure the heat on the surface of the skin, despite the fact that the heat is being delivered below the skin. However, the temperature drops as it crosses the skin, so when they're measuring it on the surface of the skin, it's lower than where it's actually being delivered. So that doesn't really tell you the real-time temperature. So the Precision TX is a safer procedure. How does it work? Well, that side laser, when it's aimed down, melts fat and it tightens connective tissue. Then when it's aimed up, it tightens the skin underneath the chin, underneath the jawline, on the neck, and we can even cross over the jawline and tighten the skin on the lower cheeks. And what we see then is that we have an improvement in this whole area from the lower cheeks down, basically down to the clavicles. The procedure takes less than 90 minutes. Patients are awake but sedated. And the procedure is done through 3 small holes, one right here under the chin, and then 2, one on each side under the ears. They are so small that they don't need sutures, and you don't need anesthesia because you have the sedation and you have this what's called tumescent anesthesia, which numbs you from about here down to the clavicles. After we take the laser out, then we suction out the melted fat, and that helps really define the jawline. And then the procedure is done. We put polysporin on those incisions, we cover them with 2x2s and a big bulky dressing, and then we put on a garment, which is really sort of a very fancy ace wrap. It goes around the neck, it goes around the head, and studies have shown very clearly that if you wear that garment around the clock for 4 days and then wear it at night for 2 more weeks, that you get better and faster results. So I am very strong in my encouragement of patients to wear it exactly that way. So the procedure is an outpatient procedure. It takes less than 90 minutes. It's over and patients can go home once the laser lift is done, but they have to have someone drive them home because they're not able to drive a vehicle themselves. They're still under the effects of the oral sedation. It takes a little while to see the full results. You will see the effect of the fat removal. That angle here, we aim for about 110-degree angle here in the cervical mental area. And you'll see that as soon as the swelling goes down. And you actually have a lot of control over the swelling. It goes down fastest in the people who eat the most cleanly. And by cleanly, I mean staying away from foods and beverages that are salty, staying away from foods and beverages that have added sugar, and staying away from processed foods, which are basically anything that comes in a box or a package. No bread, no pasta, no cereal, no crackers, no cookies, no chips. And you can live like that for, 3 to 5 days. You really can. And if that means that you have faster recovery and better recovery, that's the whole point. So you're going to see the effect of the fat loss by 1 to 2 weeks. It takes a little longer to see the effect of the skin tightening and the skin thickening. The skin tightening, you tend to see the maximal effect of that at about 4 months, and the skin thickening reaches its maximal effect at about 6 months. If you have any additional questions, please comment below because I love answering those. I hope you have a great week. Enjoy this beautiful weather. The fact that it's acting like spring out there. And I'll talk to you again next week. Take care.